So, based on some of the natural history studies where they've interviewed thousands of families with Rett syndrome, the most common are dealing with constipation and gastroesophageal reflux. In addition, there's a few others like swallowing difficulties. There's problems rarely with gallbladder function, and air swallowing and bloating can be another issue. So they can be managed based on symptoms. So sometimes therapies like medications can help. Sometimes changes in diets can be used to help alleviate some of the symptoms. Right. I mean, one of the challenges with children with Rett syndrome is they may not be able to communicate exactly what's going on to them. So if they're experiencing pain, sometimes the assumption is maybe they're having a muscle spasm or an ache in their body, but it can also be because they have significant constipation or they're having heartburn. And because they can't communicate necessarily exactly what's going on, all these things need to be considered when a patient's struggling with pain. Yeah, so children with Rett syndrome may be having, say, for instance, behavioral issues or pain expressions that are assumed to be just related to their neurologic status or condition. However, sometimes their status is impacted or affected by pain from the GI tract, so they're agitated, upset, perhaps because they're cramping due to significant constipation, or they're having heartburn and they're not able to communicate it clearly to their family or care provider. So addressing those, or at least considering them as potential contributors to their comfort, is an important part of keeping a patient with Rett syndrome happier and healthier.